So having gone through all of that, and I hope there's a context here, base thermal is where the action is. Energy use and emissions are going in the wrong direction. Whatever you feel about climate change from a government policy standpoint, we're running out of time. 2030 is a year closer, 2040 is a year closer than it was a year ago. We need to find a way to redouble our efforts, and you've got Greening Healthcare's commitment to do everything we can to help you individually to drive forward with what can be done, which leads to what the rest of this conversation now is what can be done. And the conversations which Michael had with many of you were universally around, we haven't necessarily got capital budgets available to address some of the big things like decarbonization and low carbon central plants this year, but we need to deliver operating cost savings. The hospital is, the budget pressures are not going away. We've got so many other things we need to be spending our money on. So can you focus on the operational maintenance, low cost things with a short payback that ideally we can fund out of the operating budget that we will now characterize, I don't like the term, but we'll characterize as the new low-hanging fruit. And we asked those of you who've been with us for up to 20 years will recall that we've had a number of checklists that we provided over the years that people have used that have worked fairly well. Amandeep stepped back before this meeting and said, let's consolidate those together and just pick the top 12. What are the things that we think everybody or most people could be doing right now that your annual reports can prioritize for you, saying this is probably going to apply more here and this one there, that we can pick up. And we thought, so then how, if we identify those measures, which I will in just a moment, then how do we help people, again, prioritize and put those together? And we have our technical panel built to talk that through. And we'll talk at the end about the resources that we plan to make available to you to help you drive forward. So as there are 2 or 3 times in the year where drum rolls would be good if Zoom could only do a drum roll. But in this case, here's the first 6 of the top 12 measures. And if you've either done or effectively put into place these things, I guarantee your hospital will be at that top end, will be at the top end of that benchmark chart. And many of you are going to deliver hundreds of thousands of dollars a year in savings, again, without significant capital expenditure, just by running what you've already got as smartly as you can. Item 1, and I'm not going to dwell on these because we're going to invite you to contact us, and Amandeep, who's much smarter at this than I am, will walk you through measure by measure, help you to prioritize which ones make sense for you, and get started, get moving with folks. So that's what the rest of this webinar today is around. But scheduling is everything. So turning down or turning off air supplies during periods of low occupancy, starting with administration and non-clinical areas, that is absolutely the #1 thing you can do. And the color coding on the left-hand side there says that's going to save you base electricity. It's going to save you cooling electricity. It's going to save you base thermal through reheat, and it's going to save you heating thermal through less use of outside air when it's not needed during the wintertime. So #1 measure, and again, each of you is better able than we are to assess, well, we're already doing that. Are you doing it everywhere? That's a good conversation to have. Then item 2 that I think Jason's going to focus on when we open the panel discussion just a moment is matching the minimum outside air volumes to what's required, especially during in recirculation systems, and you can read that, I won't go through it. The biggest opportunity on fan power, which is the biggest opportunity on base electricity, which is the biggest opportunity on total electricity use, looks at static pressures. Many systems are supplying perhaps the right amount of air and just using more static to get there. It's a remarkable way of saving a lot of electricity just by addressing static pressure. When we look at crazy energy numbers, leaking valves are often to blame. And even though they're expensive to replace, you got to replace them sometime, and they're not going to start paying back until you get either repairs or or replacements in effect. Filters can suck up all kinds of static pressure within systems. Other opportunities for improving that. The enthalpy wheels, heat wheels, whatever you have out there. We have a project that we'll be starting up with Alberta Health this year and extending into Ontario about optimizing the performance of heat wheels, which is a key part. So that's number 6. Number 7 in the whole thing is getting an air testing contractor in, which many of you do and many of you don't. And we had that survey last year that identified it was pretty much an even split to get in and check air flows and make sure they're where they should be. That points you to opportunities to lower energy use and gives you the assurance that you have a healthy work environment and patient environment. Where it's a really simple one. If you've got standby air handling units in the event of emergency, run them both in parallel. Each one's running at half airflow, saves all kinds of static pressure. Look at your glycol pumps in number 9. Look at supply water temperature for both heating, reheat, glycol and chilled water in number 10. Number 11, which I'm guessing Alan's probably going to pick up in just a moment, is isolating inactive steam lines. It's amazing just how much heat steam lines running through the hospital that maybe go to a fan room that doesn't have any heating required in the summer, shut them off when you don't need them. And boiler plant efficiency. It's, ultimately we're moving towards low carbon plants with a lot of electrification, but boilers are not going away anytime soon. And running the plants we've got as efficiently as possible in all seasons of the year is fundamental. So I'm hoping everybody watching this right now they've already picked out their favorite, whether you're a member hospital or a non-member hospital, you've already picked out the 3 of these things you think you're already doing, and the 2 or 3 that could really make a difference. And that I'm hoping is what you're listening for as we move into the panel conversation happening right now. So if you're into low-hanging fruit, then we call you a fruit picker, and the fruit picker's user guide looks a lot like this. The top 12 measures are the most straightforward. Doesn't mean that they're easy to implement. It still needs effort, it still needs work, it still needs time, but they're the most straightforward to implement, and everything on there is going to show up at the meter in terms of savings. They're going to be very material savings that will show up on your meters and will contribute to the overall program savings. The second thing is it's not for an energy manager to do this or a facility manager to do this. It's a team effort. And your operations team, your building automation system provider, your air testing contractor, your engineers of record, they're all part of that team. Engage them in all of this work, because for this to be done properly and sustainably means everybody has to be at the table. It's a very systematic process. It's not, that's a good idea, let's reset supply air temperatures and just do it across the board and hope for the best. You do it incrementally, you do it a piece at a time, you work your way through, you go through trial and error, you learn as you go. So picking the best measures, getting the team together, setting an implementation plan in place, making sure somebody's responsible, and then deciding how are you going to measure, how will you know if you got it right? How will you be able to measure the benefits, the results? And we're saying the starting point of that is going to be the quarterly savings reports, which Michael sends you every 3 months, whether you're looking for them or not. If it's not showing up at the meter, what you did didn't work. And finally, we're again putting ourselves out there that we've got some very strong technical people here. They want to help, but we can only help when invited in by you guys. So request guidance in terms of setting priorities, reviewing implementation plans, and let Michael know if you're at the place in your program where you're ready for help. So readiness is everything. But this is the user guide. Keep in touch with us. Again, this presentation, the slide deck, will be up on our website within a couple of days. This is your guide